times have changed. I didn't care about my health at one point of my life, and then obviously as you grow older you start caring about your life as well, and as you grow older you start focusing and working on so many different aspects of your life. And I definitely want to say this right away, that thank you, because when my mom was unwell I was talking to you as well, and thank you very much for that as well.
Sure, my pleasure.
मेजोरिटी नेपालीहरूको एउटा समस्या चाहिँ के रहेछ भन्दाखेरि चाहिँ मैले थाहा पाएको चाहिँ आफ्टर माई मम गट स्लाइटली अनवेल वाज कोलेस्ट्रोल इज लाइक सच अ बिग डिल होइन. अनि मलाई त थाहा थिएन, त्यो आफूलाई नपरिन्जेलसम्म त्यो आइडिया नै हुँदैन रहेछ होइन. वाट आर द थिङ्स द्याट यु हेभ टु फेस अन अ डेली बेसिस वेन युआर वर्किङ नेपालमा स्पेसिफिकली?
So I think there's two parts to what you're talking about. So I'm a heart surgeon, okay? So professionally, I come with patients. Professionally, I look, most of the patients are at when they've already had the disease.
It had already happened, yeah.
Right. So the spectrum I see are the patients that are in, to some degree, let's say, I won't say trouble, need some help surgically.
Yeah.
So that's the group I'd see.
Yeah.
Now coming down to the basic part with what you're talking about, cholesterol is very important.
Yeah.
And then the salt and the high blood pressure is very important. I think what you raise is a very important point, is that the awareness in Nepal has improved tremendously compared to maybe 20 years down the line. And if you look at the statistics also, it's actually getting better because our life expectancy has grown. It was 60s, now it's 71 for females and almost 69, 70 for males. So that means, and what is important with this disease, the cardiovascular disease, this is the number one killer in Nepal also. Almost 17% of deaths. Almost 18.6 million deaths a year is because of cardiovascular disease. And what we know medically is that South Asia is one of the, like the Western countries are getting it down, we are going up. Okay? So what we say statistically is cardiovascular deaths due to heart attack, stroke, all these things. Among patients who die who are less than 70 years age, 1 in 3 is actually a premature death, meaning you could do something about it.
Yeah.
Okay? And this is even higher in low middle income countries, which we are.
We are right.
Exactly.
There, yeah.
So we are right in the, it's what I would say is a cardiovascular epidemic. And that's why there's a lot of things how to tackle it. Now coming to the basic part of it, so like you said, so there's very components, there are a lot of components of heart disease, but sticking to, I think what you are working on is the hृदयघात भन्छ नि, heart attack and coronary disease भन्छ हामीहरू भनेको मुटुलाई सप्लाई गर्ने रगत नलीको disease. So those are high blood pressure, diabetes, cholesterol, and then there are some genetical factors. So you could have age. So as you grow older, you have it. So that's something you cannot change. Gender. If I'm a male, I have a higher chance. But after menopause, females will have and then genetic disorders. So these are things that you cannot change. But what you can change is your blood pressure, your diabetes, your cholesterol, your lifestyle, exercising. Now coming back to what you talked about, the high blood pressure part. It's basically awareness among people who are more than 40 years or 50 years old. Almost 40% have high blood pressure. In Nepal. This is Nepal statistics.
40%?
Yes. So there was a study done some time back where they looked at prevalence in the sense the presence of high blood pressure, awareness about it, whether you're seeking treatment, and actually you're having a proper treatment. So 4 components. So that's improved compared to previous years. So that's a very interesting thing. So it's improved compared to previous years, but
the problem is still there.
Yeah. So and I think that's the more important thing is I think like these things that we discuss, and it goes out to the audience. At least it brings awareness.
Yeah. It hit me. कस्तो हुँदो रहेछ भने obviously a person like me, I barely understand anything. I know, forget about medicine. I know, and when it happens to your family, होइन इन योर हाउस आफ्नो घरमा भइसकेपछि मात्र त्यो थाहा हुन्छ भनेर भन्छ नि होइन त्यतिखेर चाहिँ त्यसपछि इट हिट्स यु कि यु लाइक ओ माई गड यु डोन्ट रियलाइज इट आई सेयर दिस स्टोरी विथ यु वेयर people that I know हुन्छ नि होइन विदिन माई स्पेक्ट्रम चिनी खायो भने सुगर हुन्छ चिनी खाएन भने सुगर हुँदैन होइन त्यस्तो त हुँदै होइन डायबिटिज इज समथिङ द्याट क्यान ह्यापन it's probably not related to sugar at all, but that's the misconception that we have as well. Yeah. So those are minor things that we have here. Okay?
This program is brought to you by Vyas Studios.
Thank you very much for supporting the podcast so far. And if you want to see more content, more shows, then make sure that you subscribe to our channel.